doctor isn't calling. Why it isn't calling the doctor? Hi friends, hope you're doing well. After 2 days, I'm gonna have a brain surgery. This is to remove a bubble full of fluid from my brain. This bubble is called a cyst. There are different kinds of cysts that can be formed in the brain. Mine is called an arachnoid cyst. I've had it since birth, but we only recently knew about it when I did a test called MRI. By MRI, we can get a picture of the internals of the brain. Here we can see the cyst. It is highlighted in the pictures. It is on the left side behind the eye.
Huh?
On my nose? Is it in my nose?
No. Behind the eyes, inside the brain. Yeah, here, yeah.
It even pushed the left side of the brain downward. Compare the left side of the brain where the cyst is to the right side, which is normal. Also, the skull bone is thin where the cyst is. The cyst is almost the size of an egg. It gives me a lot of headache and nausea. Do you know a doctor who does brain surgery is called a neurosurgeon? Before my surgery, the doctor will put me to sleep by giving me general anesthesia. Due to anesthesia, I will not be in my senses and will not feel any pain. Then the surgeon will drill a hole in my skull and insert a device with a camera, needle, and needles on it. The camera will help the surgeon see the cyst. The surgeon will poke multiple holes in the cyst to deflate it. Then he will glue the pieces back on my skull. The surgery will take about 2 hours. Now I'm at the hospital. Oh, they gave me trouser, shirt, socks. What is this? No, bonnet.
Mm. Are you watching TV?
Instead, it's a squirrel. A bonnet.
Good morning.
Are you ready, Ameer, for your surgery?
Oh, yeah.
Okay,
Yeah.
and then he picked cotton candy, so he's going to get cotton candy.
Mm-hmm.
Right, Ameer?
Yeah, wild rats and
And
so
then as soon as we're done with the surgery, Dr. Levy will come out and speak to you.
All right.
And then as soon as he's awake in the recovery room, someone else will come and get you and you can join him there.
Okay.
Okay?
Good.
Okay.
All right?
Yeah.
So I go out.
Yeah,
like-
come on out this way.
You want to give Daddy a kiss? You can order your
Oh.
You go do that spaceman mask with her, okay?
Okay, go with her.
You want to drive one of these cars?
Those cars don't work.
Yeah, they do. I think they do.
Okay, well watch. You can get in there and you're gonna be slamming into the walls for.
Oh, he will take.
You know how to drive it? Wait a second, turn it on. Let's see.
That's what I'm saying. You're gonna be slamming into the walls. That's why we don't do it.
I don't know how to do it. fun to drive that in.
Yeah. Okay, go with her now.
I'm sure you
Bye.
would have been a good driver.
And my dad was staying with me today.
Nice.
Alright, let's go.
Well, you look like you'd be a good driver. Okay, so we're gonna go this way.
I gave him some medicine
For pain?
for pain.
Okay.
Yeah, and the last time I asked him, I woke him up and asked him, and he said he didn't hurt. So I think we're good. We're gonna go to your room now. Okay.
Okay.
And this
Oh,
is
look, he's getting.
yeah, there he is.
Amir? Amir?
Yeah.
How are you, mommy?
Good.
Are you feeling good? No pain? Good boy.
Okay, Mama, would you mind?
Slowly.
You're doing it the easy way. I pick up. There you go.
Let me see your face as you're walking. How many of me do you see? One or two? Oh, good. I'm glad I don't have a twin. I'd have to share all my toys.
How are you feeling?
Good.
Does your head hurt?
No.
Can you open your eye full?
Yeah.
Okay.
Blinking my eye. I can also blink.
Yeah.
All right, she wants you to come back in 3 months to see Dr. Levy.
Sure.
Hope you enjoyed this video. Please like and share this video. Please subscribe to my channel Learning with Ameer. And follow me on Facebook and Instagram. See you next time. Bye.